We are live now, doctor.
Okay. Shilpi, can we have it? So, good evening, postgraduates, and my namaskar to all the mentors. Welcome to this Pan India Intercollegiate quiz by the team of Brain Teasers. And this particular postgraduate quiz is in association with Ophthalmological Society of Nagpur. Let's hear through this our familiar tune.
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं है।
तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर आठ
Okay. So, good evening, friends, once more, and my pranam to all the mentors. Brain Teaser team welcomes you to this fourth episode of the fifth season of Big Q. Well, to the people who have joined today, Brain Teaser is an online platform for hosting quizzes for ophthalmologists of our country since last 7 years or seasons, I should say. And it was 4 years back when we thought for the first time to initiate an exclusive quiz for postgraduates of our country with the single aim of getting all postgraduates from across the country on a single platform. We are very fortunate. We have almost 320 institutions offering post-graduation in ophthalmology, be it MS or DNB. And this season, we have almost 240 plus teams registered, and we are very proud of it. So this fifth season would be having 6 preliminary round, and today is the fifth preliminary round. It will be followed by 4 quarterfinals, then 2 semifinals, and then one final. All the episodes will be aired on alternate Wednesdays at 7:30 p.m. Brain Teaser team is extremely thankful to the team of quiz masters who toil hard to create a wonderful experience of learning with fun. And we are fortunate to have this time in this today's episode three ladies who are going to be the quiz masters. So the first is Dr. Madhuri Venigala, who is currently a consultant cornea and refractive surgeon at Shankara Eye Hospital, Guntur. Welcome, ma'am. Second quiz master for the
Thank
today.
you, sir, for having me.
Thank you, Dr. Madhuri. Second quiz master is a dear friend of mine, Professor Dr. Shalini Mohan, who is officer in charge of glaucoma, eye bank, cornea services at GSVM Medical College, Kanpur. Welcome, Dr. Shalini.
Thank you, sir. My pleasure.
And the third quiz master is Dr. Shailaja, again a dear friend of ours, who is an associate professor and vitreoretina consultant at Kasturba Medical College, Manipal. Welcome, Dr. Shailaja. Thank you.
Thank you, sir.
It's a privilege to have you all. Friends, money maketh the mayor go is an old saying, and such mega projects are not possible without a strong financial support from pharma or health industry. His Highness has been our partner since last 2 seasons, and my sincere most gratitude to Mr. Surenaran, Mr. Naresh, Mr. Kaustup for their support and pushing us to start seasons every time. Also, I would fail in my duties to if I don't acknowledge the field force of His Highness, who made so much of effort to enroll almost more than 250 teams for this particular season. Smooth and flawless execution of Brain Teaser platform, all courtesy is because of Numerotech and team. My sincere most thanks to Sai and his team for being with us since last 7 seasons and helping us out going through this online quizzing almost flawlessly. And equally important, let me last but not the least, my co-host Dr. Shilpi Narnavre, who has been associated with us since last 7 seasons and who is a vitreoretinal surgeon in our hospital. Thank you, Shilpi, for being with us throughout all these 7 seasons. And now I request Dr. Shilpi to familiarize all the participants with the rules of the quiz. Over to you, Shilpi.
So,
Welcome, friends. Welcome back to the fourth episode of this season, that is, fourth preliminary round. So, what's the format? You all are aware, but let's quickly see. So, total prelims will be six, and today is the fourth episode. And criteria for qualifying for the quarterfinals is the best of the four performances of preliminary rounds. So you'll need to log in from two devices, one from the Kahoot platform and another is Zoom platform for the live quizzing. And you need to answer only from the second screen, that is the Kahoot. I request all the mentors to log in from the separate screen only on the Zoom platform. So in today's episode, we'll have 6 sets of MCQs. Each set will have 5 questions. You will get 10 seconds per question and there is no negative marking in today's episode. So these are the prizes for the postgraduates in the finals. While for the audience, we have prizes per episode, and these are the 5 prizes for the audiences in this episode. So, with this, I invite our first quiz master, Dr. Madhuri ma'am. She has done her MBBS and MS from Guntur Medical College, DNB in 2007, short term glaucoma fellowship from Shankara Netralaya, Chennai. She did her fellowship in cornea and anterior segment from Sankara Eye Hospital, Guntur. To her credit, she received gold medal in MS Ophthalmology, Best Outgoing Student Award, and Best Paper in APOS 2017. Currently, she is working as consultant cornea and refractive surgery in Sankara Eye Hospital, Guntur. She is a DNB thesis guide, co-guide, mentor, and a teaching faculty and participates in various journal publications. She has presented various papers, faculty lectures, and attended many conferences. Over to you, ma'am.
Thank you, Shilpi Madam, for the nice introduction. Let us start. The first question goes like this. It is a 66-year-old male patient who presented with diminished vision and pain of the right eye for the past 10 days. His history has he has undergone penetrating keratoplasty 2 months ago, and the anterior segment picture shows this with visual acuity of 20/200. So what is the clinical diagnosis and next best step in the management? Option A, corneal infiltrate, repeat PK. Option B, corneal farinata and topical steroids in the management. Option C is infectious crystalline keratopathy, treatment by topical antibiotics. And option D is disciform keratitis with topical Lessivier eye ointment. The time starts. Yes. The correct answer goes in favor of C, that is infectious crystalline keratopathy, usually caused by gram-positive Staph aureus, and usually treated with topical antibiotics like fortified Vanco, Moxie, and steroids, and low steroids like FML. So we go to the next question. Which of the following is seen in Lovis syndrome? Option A, glaucoma. B, choroiditis. C, secondary cataract. D, myopia. Time starts now. Yes, the correct option is option A, glaucoma. So it's an X-linked disorder usually associated with bilateral congenital cataracts, infantile glaucoma, and with brain, some intellectual disability and hypotonia. Okay, the next question. Carefully observe the picture. It's a 55-year-old man who met an accident several days ago. He complains of intermittent vertical diplopia since the accident. His visual acuity is 20/20 in each eye. His motility is diagrammed in this picture. If only a single muscle is involved, which muscle is palsied? Option A, left superior rectus. B, right inferior oblique. Option C, right superior oblique. And option D is left inferior rectus. The time starts now. Yes, the correct answer is option C, that is right superior oblique. Superior oblique basically it causes depression and torsion. So the patient has right hypertrophy and primary position, which is more on left gaze and also on right head tilt. So it indicates a right superior oblique palsy. The next question. Which statement about the eyelid anatomy is false? Carefully see the answers. Option A, the gray line is formed by the muscle of Rhealan and represents the observable edge of the pretarsal orbicularis in the eyelid margin. Option B, the posterior lamella of the eyelid consists of the conjunctiva and tarsus. C, the mucocutaneous junction occurs where the eyelashes emerge from the eyelid. And D, the peripheral and marginal arterial arcades allow for anastomosis between the internal and external carotid systems. The time goes now. Yes, come on. Yes, the answer, correct answer is option. The wrong answer is option C, where the mucocutaneous junction occurs posterior to the eyelashes near the opening of the glands. It doesn't occur where the eyelashes emerge from the lid. Okay, the next question. Intravenous or intravitreal antiviral induction therapy for cytomegalovirus retinitis is given approximately for how many days? Option A, 2 days, B, 5 days, C, 7, and D, 2 weeks or 14 days. The time starts now. That's a correct guess. The answer is option D, that is 14 days. Usually it can be IV foscarnet or ganciclovir. The next question goes. Okay. I take the privilege to introduce Dr. Shalini Mohan ma'am. She is presently an officer in charge of glaucoma, eye bank, cornea, and professor at GSVM Medical College, Kanpur. She has done her senior research association from AIMS Delhi and senior residency also from AIMS Delhi. And he has been a consultant at Sir Gangaram Hospital, Delhi. And she's at present, she is a president of Kanpur Ophthalmic Society, editor of UP Journal of Ophthalmology from 2018 to 21. And she is an ex-Central Zone representative for the Glaucoma Society of India. She's an organizing secretary for UP State Conference. And she has many publications to her list, around 121, 437 presentations. And to her credit, she has got many medals like Dr. B.C. Rai Gold Medal, UP State Award, Kanpur Ratna, Nari Shakti Saman Shakti Swarupa, Dr. Mohanlal Gold Medal, Pandey, Dr. V.N. Raizadar Award. And she has done many novel techniques of first surgical techniques started in Kanpur, like first DMEC and lamellar surgery, first exentration surgery at Kanpur District Hospital for mucormycosis, which has publications in many international journals, like Journal of Glaucoma. Over to ma'am.
Thanks a lot for the nice introduction, Dr. Madhuri. Good evening, everyone, and all the best to all the participants. So the first questions on your screen is identify the device implanted. And your options are iStent inject, CyPass stent, Hydrus implant, and Express implant. And your time starts now. So the answer is hydrous implant. So you can see this implant, which is a small eyelash sized metallic device made up of flexible nickel titanium alloy, which is used for microinvasive glaucoma surgery, implanted into Schlemm's canal and is indicated in the case of mild to moderate primary open angle glaucoma. Next question. Now see the picture carefully and mention the particular prerequisite for the implantation of this IOL, which is shown in the figure. And your options are: this is especially useful for post LASIK patients. Option B is it is implanted after flax surgery. Option number C is it is beneficial in post radial keratotomy patients. And option D is it can be implanted in pediatric patients. Your time starts now. And the answer is it is implanted after flax surgery. So this is a very special type of IOL, which is known as femtis IOL, which is capsulorhexis fixated IOL. So it allows very predictable positioning of, and it is benefited by automated capsulotomy. So if automated capsulotomy you can do while doing your flax surgery or zeptocapsulotomy. Now you can see there are 4 additional clip haptics which allows exceptional stable position of the IOL, and it is especially useful for fixation in the capsular bag. Next question. Now see this particular picture carefully. You can see the under eye bags. You have to identify the drug which is used for procedure done to correct under eye bags. And your options are methyl cellulose, option B, hyaluronic acid, option C, chondroitin sulfate, and option D is any of the above. And your time starts now. So the correct answer is hyaluronic acid. Now, hyaluronic acid is used to correct these under eye bags, and it is injected as a eye filler or dermal filler. It lasts for approximately 8 to 15 months and gives good cosmetic appearance, especially useful for sunken appearance of eyes. Next question, please. So you have to identify the pair with the wrong vitreous implants match. So the options are Vitrasert, which is a gang cyclovir implant. Option B is Retisert, which is a fluocinolone acetonoid implant. Option C is Dex implant, which is dexpanthenol. And option D is all pairs are accurate. Your time starts now. And the correct answer is the option C. So Dex implant is not dexpanthenol. The Dex implant is the dexamethasone implant. And rest A and B are correct pairs. So next question, please. Halting progression of myopic refractive errors include. The options are simultaneous myopic defocus in addition to the normal corrected image. Option B is adding pharmacologic drugs like parasympathomimetics. Option C is both A and B. Option D is none of the above. And your time starts now. So the correct answer is simultaneous myopic defocus in addition to normal corrected image. So which is the option 1? So these are special type of glasses which cause peripheral hyperopic defocus, and therefore they are thought to stimulate the axial elongation as the eye grow, and because of this defocus the myopia progression is reduced. So they are used to treat the progression of myopia. Next question. So now I would be introducing your next quizmaster, which is Dr. Shailja. She is Associate Professor and Vitreoretina Consultant at Kasturba Medical College, Manipal. She has done a fellowship in surgical vitreoretina from Shankara Nethralaya, Chennai in 2007. She already has ICU fellowships in ophthalmic genetics, and her areas of interest are retinal vascular disorders, retinal imaging, and endophthalmitis. She has 40 international publications to her credit. Welcome, Dr. Shailja.
Thank you, Dr. Shalini, for the introduction. And thank you, Dr. Prashant sir and Shilpi ma'am for this opportunity. I have been a follower of this quiz right from the Brain Teasers days. So thank you for having me here today. Let's move on to the quiz now. The first question is, crystalline retinal deposits are associated with the use of all the following medications except, and the choices are A, canthaxanthin, B, tamoxifen, C, desferoxamine, and D, methoxyfluorine. And your time starts now. And the correct answer is C, desferoxamine. Desferoxamine is a chelating agent which is used to treat chronic iron overload. It causes vision loss, pigmentary retinopathy, and ERG changes, while the drugs which cause crystalline retinopathy are tamoxifen, methoxyfluorine, canthaxanthin. Other than this, crystalline retinopathy can also be seen in cystinosis, Beatty's dystrophy, and parafoveal telangiectasia. Let's move on to the second question. Which one of the following is associated with familial adenomatosis polyp and increased risk of colorectal carcinoma? Choice A is solitary congenital hypertrophy of the retinal pigment epithelium, B, grouped chirpy, C, combined hamartoma of the retina and the retinal pigment epithelium, and D, atypical chirpy. And your time starts now. Let's look at the right answer. It is D, atypical chirpy. As we know, the grouped chirpy is the one which is classically described as the animal prints or the bear track appearance, which is usually unilateral and it is not associated with FAP, while atypical chirpy, which is comma or spindle shaped, which is bilateral and is associated with the increased risk of FAP and colorectal carcinoma. Move on to the next question. Question number 3. Redox phenomenon refers to which of the following? And the choices are A, statokinetic dissociation, where the moving objects are perceived but stationary ones are not perceived. B, worsening of the visual symptoms on increase in the body temperature. C, perception of the two-dimensional objects as three-dimensional. And D, which is electrical sensation on flexion of the neck. And your time starts now. And the correct answer is A, that is the statokinetic dissociation, where moving objects are seen but stationary ones are not perceived. This is usually seen in occipital lobe lesions, whereas worsening of the visual symptoms on increasing the body temperature is known as Uthoff's phenomenon, which is seen in multiple sclerosis. Electrical sensation on the neck flexion is the Lehermitz sign, and the perception of the two-dimensional objects is the Pulfritz phenomenon. Yeah. Let's move on to the question number 4. The photopigment gene for the opsin of S cones is located on which chromosome? Choices are A. Chromosome 3, B. Chromosome X, C. Chromosome 7, and D. Chromosome 13. And your time starts now. And the correct answer is, it is chromosome 7, which has the opsin for the blue pigment, whereas the chromosome X is the one which has for the other two red and green pigments. Let's move on to the last question. Given below are the named OCT signs and the clinical entities in which these signs are seen. Which one of the following is incorrectly matched? Choice A, ILM drape sign seen in macular telangiectasia type 2. B, pearl necklace sign seen in chronic cystoid macular edema. C, flying saucer sign, hydroxychloroquine toxicity. And D, cotton ball sign, candida endogenous endophthalmitis. And your time starts now. And the one that is incorrectly matched is cotton ball sign, which is not seen in candida endogenous, but it is a finding which is seen in epiretinal membranes, whereas the other three are correctly matched. The ILM drape in macular telangiectasia, flying saucer sign in HCQ toxicity, and pearl necklace sign in chronic CME. Thank you.
Thank you. Thank you, ma'am. So we are over with the 3 sets of questions. Now it's time for the commercial break. I thank the His Highness team for all the support. So with this, I welcome again Dr. Madhuri ma'am for conducting the next section, that is section 4.
To section 4.
Ma'am,
Can
we
we start?
Yes, yes, ma'am.
Yes. The following measures can be taken to limit the post-op procedure.
Can't hear you properly.
The following measures can be taken to limit post-operative hypotony with the device, except option A. Yes, ma'am. Can you?
No, ma'am. Only I'm having the problem, or others also facing the same problem?
Am I audible?
Ma'am, yes, but yeah, I don't know whether your internet is unstable or mine.
Madam, no, our internet is stable. I think Madhuri madam has a problem.
Madhuri.
Okay.
Um, shall we proceed, ma'am?
Yeah, the option A is two-stage procedure. Option B, collagen plugs. Option C, pressure sensitive valve. And option D, ligature occlusion of the tube. Your time starts now. The answer is option C. It's a beer wells implant. It does not have a pressure sensitive valve. So the hypotony occurs in the early post-operative period. It has to be managed by other means. Hypotony is common when the drainage implants are installed in a one-stage procedure without complete tube occlusion. So the next question. Which structure divides the lacrimal gland into two lobes? Option A, orbicularis oculi. Option B, tarsus. C, Wignall's ligament. And option D, levator aponeurosis. And your time starts now. So the correct option is option D. That is a levator aponeurosis. Next question. Latent nystagmus is characterized by all the statements except option A, null point in adduction. Option B, the fast phase towards a fixing eye. Option C, increases with monocular occlusion. And D is often associated with intermittent exotropia. The time goes now, starts now. So the correct answer is option D, where the latent nystagmus increases with the monocular occlusion when the fixing eye is in abduction, that is a null point in adduction, and the fast phase is towards the fixing eye. It is associated with the disruption of early binocular visual development and is not acquired strabismus. The next question. It's a pathology related question. The slide shows the cells which are distended by round eosinophilic cytoplasmic inclusions. Normal versions of the cell type are seen nearby. Is the cell type of the cells shown in figure. The arrowhead. The options are option A, hemosiderin-laden macrophages. Option B, CME-infected retinal cells. Option C, plasma cells containing immunoglobulins. And option D, polyhedral melanocytes. Your time starts now. The correct answer is option A. Option C. It is a plasma cells, a type of lymphocytes, commonly have a perinuclear halo, where the arrowhead shows Russell bodies appear as rounded cytoplasmic inclusion bodies. And inclusions, so the answer is the plasma cells, which contain immunoglobulins. The next question. Which of the statements regarding the clinical condition is found in this 73-year-old woman is true? Option A, biopsy of the adjacent conjunctiva may show increased plasma cells. Option B, corneal perforation will occur rapidly. Option C, systemic immunosuppression will be necessary. Option D, it is a painless, slowly progressive process. Time starts now. So the answer is option A. So it's a case of Moran's ulcer. You note the conjunctival injection, the ulceration of the peripheral cornea, undermining the undermined leading edge. So the pain may be severe, photophobic. It's an autoimmune process, likely plays a role. Can be two types. The older adults will show the unilateral one with mild pain. The other type is a bilateral, usually occurs in young persons, which is rapidly progressive, where the perforation is relatively rare. Next question. Over to Shalini ma'am.
Yes. So the question number 1 is true about endothelial keratoplasty is DMEC is reserved for post-cataract surgery corneal decompensation. DSEC is procedure of choice in Fuchs endothelial dystrophy. Failed grafts can be managed well by DSEC. All are correct. And your time starts now. And your answer is option C. So, failed grafts can be managed well by DSEC. DMEC is more preferred surgery in Fuchs dystrophy, and DSEC is used for complicated cases. Next question. A 40-year-old male patient presented with sudden onset painless loss of vision for past 2 days. History revealed using medications for diabetes that led to weight loss of 10 kg. The examination revealed best corrected visual acuity of hand movement close to face, and fundus image showed blurred disc margins. The probable cause of such a situation is option A, retrobulbar neuritis, option B, diabetic papillitis, option C, ischemic optic neuropathy, option D, optic nerve head glioma. And your time starts now. So your answer is anterior ischemic optic neuropathy, which is commonly seen following GLP receptor agonist, which is nowadays used to reduce weight loss along with reduced blood sugar, but it is known to predispose the patients for non-arthritic anterior ischemic optic neuropathy. Next question, please. Immune-mediated uveitis is characterized by all except, and your options are T lymphocyte appear to play an important role in pathogenic. Option B, corticosteroids are very effective in controlling the inflammation rapidly. Option C, extended periods of therapy is required steroid sparing agents. Option D, steroid sparing agents have minimal side effects so can be continued lifelong. And your time starts now. And the correct answer is fourth one, steroid sparing agents. They also have side effects. It is not that they can be continued lifelong, and therefore the option is not right. Next question. Most common childhood ocular malignancy is, your options are option A, patients with a germline mutation in RB1 gene, they are at increased risk. Option B, it follows an autosomal recessive inheritance pattern with high penetrance. Option C, only genetic inheritance is responsible for the disease. Option D, can never be associated with any soft tissue malignancy. Your time starts now. So the correct answer is option A, that is patients with germline mutation in RB1 gene. It is the retinoblastoma gene which is found and it is associated, especially due to accumulated DNA replication errors in the sperm. This genetic mutation is seen. Next question. Now, carefully see this particular picture. Now, it has a white arrow pointing to a particular problem in the OCT image. You have to tell what is true about the condition highlighted with white arrow. All except you have to identify. Option A is height determines the prognosis. Option B is uncommonly seen in eyes with PED. Option C is subfoveal are associated with poor visual acuity recovery. And option D is these are known complications of neovascular AMD. Your time starts now. So because it is all except and therefore the correct option is it is uncommonly seen in eyes with PED. So it is a condition of RPE RIP and therefore it is commonly seen in eyes with PED, especially with fibrovascular PED. Next. So now I invite Dr. Shalja for further questions.
Sai.
Yeah.
Ma'am,
Thank you, Dr. Shalini.
ma'am,
Madam.
let's wait for a minute. Sai,
Yeah,
students
madam.
are
Yeah.
posting in the group that Kahoot is not working.
No, there was a pause actually, but it is working.
Okay.
There was a
So,
pause for a few seconds, but it is working.
okay, it's working. So, shall we continue?
Yeah. People are participating, madam.
Okay. Okay, go ahead, ma'am. Shalja?
Yeah. Okay. Yes, ma'am. Yes, ma'am. So we'll move on to the last section. And the first question of the last section is identify this instrument. Choice A is Canabrava ring. Choice B, B hex ring. Choice C, I ring. And D, Maliguin ring. And your time starts now. Let's look at the correct answer. The answer is D, Maliguin ring. So if we look at the this is the first picture is the one which shows the Canabrava. The second one is the Canabrava ring. The first one is the B hex ring, and this is the I ring. What was shown in the picture is the Maliguin ring. Let's move on to the second question. Ma'am, this optic nerve disorder is associated with which of the following condition? Choice A is Aicardi syndrome. Choice B is Alagili syndrome. Choice C, transsphenoidal basal encephalocele. And choice D is D. Morsier syndrome. And the time starts now. And the correct answer is, it is choice C, that is transsphenoidal basal encephalocele. So what is seen in the picture is a morning glory disc anomaly, where there is a large disc with the excavation in the center with the vessels arising in radial pattern, which is associated with the transsphenoidal basal encephalocele. Aicardi syndrome is seen in optic disc coloboma, whereas Alagili syndrome is associated with ONH drusen, and D. Morsier syndrome is associated with optic nerve hypoplasia. Let's move on to the third question. The third question is as follows. This is the fundus picture of a 28-year-old patient. He gives history of undergoing surgery for cerebellar hemangioblastoma 3 years ago. The genetic mutation in which of the following chromosomes is likely to be responsible for this condition? And the choices are option A, chromosome 3, option B, chromosome 9, option C, chromosome 1, and option D, chromosome 13. And the time starts now. And the correct answer is it's chromosome 3. The condition that is shown is a von Hippel-Lindau tumor, that's a capillary hemangioma, which is also associated with the other systemic associations, that is CNS hemangioma, mainly cerebellar hemangioma, pheochromocytoma, and renal cell carcinoma. And this is in the mutation in the VHL suppressor gene on chromosome 3, which is responsible for the condition. Let's move on to the question number 4. Bacillary layer detachment or Ballard refers to the choice A, that is separation of the external limiting membrane from the ellipsoid zone. Choice B, split occurring in the myoid zone of the inner segment. Choice C, separation of the internal limiting membrane from the nerve fiber layer. And choice D, that is separation of the retinal pigment epithelium from the underlying Brooks membrane. And the time starts now. Let's look at the correct answer. So Ballard or bacillary layer detachment refers to the split occurring in the myoid zone of the inner segment. And this is one of the OCT features which is being described in association with conditions like VKH, APM-PP, blunt trauma, rheumatogenic RD, etc. Moving on to the last question of the segment. Question number 5. Calamari ring sign is an indicative of, choices are option A, avulsion of the optic nerve head, option B, canalicular injury, option C, choroidal rupture, and option D, vitreous base avulsion. And the time starts now. So the correct answer is calamari ring sign is indicative of canalicular injury. So with that, we come to the end of this section.
Thank you,
Thank you.
Dr. Thank you, Dr. Shailaja. Wonderfully conducted the quiz and wonderful questions, quite exciting and quite informative as well for all of you, Dr. Madhuri, Dr. Shalini. So can we all come on the board now?
Thank you, sir.
Please, Dr. Madhuri, Dr. Shalini, Ajo. So participants, just remember, we will be inviting the winners of the today's episode from private practitioner category. And as well, you need to remember that at the conclusion of 6 rounds, we will be sharing with you who are the quarter finalists. So your marks at this point for all the postgraduate category is being put together. And once that is done, at the conclusion of round 6, that it will be on a next Wednesday. So the date is going to be February
So
3rd.
next episode is preliminary round 5.
Yeah, preliminary round 5. Yeah, preliminary round 5 will be on 3rd Feb, na, Shilpi?
Yes.
Yeah. So till then you have to hold back with us. And meanwhile, we will be having a small chat with all the participants. Any mentors are there today? Sai, can you identify some mentors?
4th Feb, sir. Wednesday is 4th Feb.
4th Feb, correct. Thank you.
Pratik Nishant has raised the hand.
प्रतीक आ जाओ भाई वीडियो ऑन कर लीजिए so one of the mentor is with us any other mentors please do join us get your video and audio on we would like to have small chat and some interaction with you and understand your feedbacks how we can improvise further and how do you find the program and all so meanwhile the this team at Numerotech is trying to assess how much is the scores for the private practitioner category till then प्रतीक आ जाइए so good evening Dr. Pratik
Good evening.
professor at RIO Patna good so this guy was for the postgraduates are watching this guy was one amongst the I think 3 seasons back he was amongst the contestant like you and now he's an assistant professor at RIO Patna and we are proud to see our people rising the ranks and now joining as a mentor. It's a proud moment for us, of course. So, Pratik, कैसा लग रहा है? Before I
Equally
come
proud
to you,
for
before I
myself
come
as
to
well,
you,
sir.
wait for a
Equally
while.
proud moment for myself as well.
Pratik,
And
hold back. Pratik, hold back. I will just announce the people from a private practitioner category. So it is BJ, Sai, Win again, Anne, and RES. So please do get your video and audio on. We would like to have a small chat with you. Our quiz masters will have a small chat with the people in the private practitioner category who have made it. So can you unshare the screen and upgrade all these people, participants as a
Can you
panel?
kindly request, I request kindly to raise their hands?
Yeah, so the numbers which are shown on the screen, they are the people who are into top 6 in a private practitioner category, BJ, AI, Win, and RES. So if you are there, just raise your hand and that will help us in elevating you as a participant in the this particular Zoom and we will have a small chat with you. So till they come back to us, Pratik कैसा लगता है भाई एक जमाने में रेसिडेंट थे और अभी देखो आप मेंटर बन गए बच्चों के
yes, sir. And I must say today's quiz was very informative and the level of questions was very nice. Like some of the most useful trivias for postgraduates were put up in the questions, and I also had a nice time answering some of those in my mind.
okay
So
hopefully it didn't help your
thanks to the
team
quiz masters. Hello.
hope you didn't help your team with the answers
No, sir. I am at home and my team is sitting separately. So yes, I did not help my team uh,
and we trust you
accurately
I'm just
following your
telling you
instructions.
शालिनी कैसा लगता है भैया ये बच्चों को आगे बढ़ते हुए देखो अभी असिस्टेंट प्रोफेसर बन गया है प्रतीक अपना यू रिमेम्बर हिम एज वन ऑफ द कॉन्टेस्टेंट्स इन वन ऑफ द टू
Yes, I remember, and
I think
it's
Shailaja
very
must
nice.
also remember
Yeah, very nice. Dr. Pratik, welcome to be the mentor now. And definitely, it is such a proud moment to see children growing up and coming to the assistant professor levels. Wow, great.
Thank you so much, ma'am.
Yeah,
good
wonderful.
Pleasure, ma'am. Pleasure.
in fact Pratik has pocketed a large amount of our brain teaser money in last few of the episodes previously so we have now become more wiser and asked him made him a mentor so that we have new faces who can earn.
Right.
Correct.
Okay. Yeah,
Correct.
very true.
Correct, sir. Very correct.
Thank you, Pratik, and keep inspiring your students like this, people like you, and teachers like you. If they are as a faculty, we are going to have a great generation next who are going to treat our eyes. So keep
Surely, sir. Thank you. Thank you so much.
best of luck, best of luck. Hmm?
Pranam, sir.
Pranam bhai. Anyone else have been upgraded? Sai?
Jai
Dr.
Prasad.
Vinny, Dr. Jayaprasad.
Sir, can we get your video on? Sir is again I should say an habitual offender. I cannot use the word, but habitual pocket. He's pocketing a lot of prize money from us, so we can call him a habitual pickpocket of brain teaser money. Sir, any comment on that? You are muted, sir.
Good evening, Prashant,
Good evening, sir.
Shalini, Mohan, and
Good
Shailaja.
evening. Good
Yeah,
evening,
good
Dr.
evening, all of you.
Jaiprasad.
Good evening,
Yeah,
sir. Good evening, sir.
yeah.
So this man keeps on. I don't know. He keeps on. Every time, every season, this man is there to pocket money. I don't know why. His thirst
Basically,
for
it is to learn,
is it his
Prashant.
thirst for more money or I don't know knowledge, because somehow at my age I don't feel the knowledge to be that craving.
I
Like,
think
Nice meeting
money
all
is
of
the
you.
byproduct. Money is the byproduct of his knowledge.
I think it's the kick of winning the quiz, sir.
Correct, Shailaja. I was teaching at Manipal, Shailaja, a long time back,
Yes, sir.
1990.
I know, sir. Yes, I
Yeah,
know, sir.
nice
I know,
meeting
sir.
you.
Nice, sir.
Yeah. Thank you all for the wonderful the quiz questions that you have put up. Very nice, actually. Making you think a
Thank
little
you.
bit. I think that way this quiz was different. It was not just numbers alone. Only two questions were there based on numbers. So concepts
Yes.
were there, making you think a little bit. And of course, few of the OCT questions went over my head because I'm not a veterinary person, and I don't usually look into all these detailed retinal OCTs. But otherwise, all the questions were very nice, very well presented, and very well conducted. Thank you so much, and thank you to Shilpa and Prashant for this opportunity. I look forward to learning through this media actually, because
somehow
I
I
will
am.
go back and see all these Prashant again. I see all these questions again and again,
Oh,
so that I always look at this and learn. Actually, go back and refer and learn. That is how I learn. Thank you so much. And I
thank
go
you.
and teach
Thank
my
you.
students too tomorrow. Okay. Thank you so much. Shailaja, nice meeting you. Bye.
Thank
Thank
you.
you,
Yes,
Bye
thank
bye.
you, sir.
Jay.
Nice
Bye.
meeting.
Bye, Shifa.
Bye bye,
Bye,
Dr.
Shalini. Bye.
Jaiprasad. Bye
Thank
bye.
you, Jayaprasad sir. It is teachers like you who, at this age, still have so much of interest in our quiz. This is why probably we are in our season 7 and season 5 for Big Q, because people like you really make us feel that yeah, it is worth all doing it. Thank you.
I'm happy that you have not given up and you are continuing with the same cess as you started it off long time back.
Correct, sir.
Right.
So,
Thank you so much. You are doing a
thank you,
great job, Prashant. Great
thank
job.
you,
Thank
thank you.
you.
Thank you. I don't do much quiz. A great job, sir. It is my quiz masters like Shelja, Madhuri, and Shalini who work hard for me. I'm a sitting duck on them, and I get some laurels because of them. So
Kudos to all of them.
No,
thank you.
Thank you.
thank you.
Thank you.
They deservedly they
Thank you,
should.
sir.
They should. Thank you. Anyone else, Sai?
Some people are refusing to come online, Doctor.
Okay. Vinith is afraid of it because another I saw his name. Vinith every time pockets some money. He's from RPC. Vinith, ajao if you are around. Don't worry, I'm not going to rag you.
I think he has left.
He has left. Okay,
I
I,
okay.
can't
I
see
actually
him now.
tried promoting him, but he left.
Okay. Then last time I ragged him because every episode he was carrying away a lot of money. He carried away, but this time quietly. Be it. So, friends, I think we had a great time. Great time. Thank you. I should say thank you, Dr. Shalini, Dr. Shailja, and Dr. Madhuri for creating such a wonderful experience for our postgraduates. It speaks a lot about your commitment to postgraduates because creating a single question takes a lot of effort. And you have to do a lot of reading, and in spite of your respective busy schedules, you devote so much of time to create such a interesting, intriguing questions. We are really thankful, and it is probably your effort that Brain Teaser is becoming more bigger and bigger with 250 plus teams this season. We are really buoyed up by the participation, and it all this goes, all the credit goes to quiz masters like you. So thank you once more to all of you, and of course to the mentors who keep inspiring their students, and of course students, thank you for participating in a big number. My sincere most thanks also to His Highness team as well as Sai and his numeratic team for helping us out in carrying this program. So postgraduates, we are meeting for the episode number 5, that is preliminary number on 4th of February, again at same time 7:30 p.m. Till then, from our end, it's time to say goodbye. Bye-bye, good night.
Thank you so much, Dr.
Thank you,
Prashant.
sir.
It is always a pleasure
Thank
to be
Thank you.
here.
Thank
And
you.
bye bye,
Thank you.
everyone.
Thank
Good
you.
night.
Bye.
Thank you,
Bye,
Dr.
all the best.
Shakti.
Bye,
Thank you,
ma'am.
Sai.
Bye, good night.
Bye.
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 Bye,
Good
Pratik.
night.
Thank you, doctors.
Thank you, Sai.